detailed explanations for each answer. 1. A patient presents with sudden facial droop on one side, inability to close the eye, and loss of taste in the anterior 2/3 of the tongue. Which cranial nerve is most likely affected? A. Trigeminal nerve, CNV, facial nerve, CN7, C. Glossopharyngeal nerve, CNA, D. Hypoglossal nerve, CN12. Explanation. The facial nerve, CN7, controls the muscles of facial expression, taste sensation from the anterior 2/3 of the tongue via chorda tympani, and lacrimal salivary gland secretion. Damage can cause Bell's palsy, leading to facial droop, loss of taste, and inability to close the eye. 2. A 40-year-old male experiences double vision and difficulty looking downward, especially when walking downstairs. Which cranial nerve is most likely affected? A. Oculomotor nerve, CN3, trochlear nerve, C. Abducens nerve, D. Optic nerve. Explanation. The trochlear nerve, CN4, innervates the superior oblique muscle, which is responsible for depressing and entorting inward rotation the eye. Patients with CN4 palsy experience vertical diplopia, worse when looking down, e.g., walking downstairs, and may compensate by tilting their head to the opposite side. NASH 3. Which artery is the most common source of an epidural hematoma after a head trauma? A. Anterior cerebral artery, B. Middle meningeal artery, C. Posterior communicating artery, D. Superior cerebellar artery. Explanation. The middle meningeal artery, a branch of the maxillary artery, runs beneath the pterion, the weakest part of the skull. A fracture here can cause an epidural hematoma, characterized by a lucid interval followed by rapid deterioration due to arterial bleeding. 4. A patient presents with difficulty chewing and loss of sensation in the lower face. Which division of the trigeminal nerve is most likely affected? A. Ophthalmic V1, B. Maxillary V2, see mandibular V3, D. Facial. Explanation. The mandibular branch, V3, of the trigeminal nerve, CNV, provides motor innervation to the muscles of mastication, chewing, and sensory innervation to the lower face and jaw. Damage to V3 results in difficulty chewing and numbness of the lower face. 5. Which cranial nerve passes through the foramen rotundum? A. Maxillary nerve, CNV2, B. Mandibular nerve, CNV3, C. Oculomotor nerve, 3, D. Facial nerve, CN7. Explanation. The maxillary nerve, CNV2, passes through the foramen rotundum in the sphenoid bone. It provides sensory innervation to the midface, including the cheeks, upper lip, and maxillary sinus. 6. A patient suffers a basilar skull fracture and loses the sense of smell. Which structure is most likely damaged? A. Cribriform plate of ethmoid, B. Sella turcica, petrous part of temporal bone, D. Mastoid process. Explanation. The cribriform plate of the ethmoid bone houses the olfactory nerve, CN9, which transmits the sense of smell. Trauma to this area can cause anosmia, loss of smell, and CSF rhinorrhea, leakage of cerebrospinal fluid through the nose. 7. A patient with a Barry aneurysm in the posterior communicating artery presents with ptosis, mydriasis, and a down-and-out gaze. Which cranial nerve is affected? A. Optic nerve, B. Oculomotor nerve, trochlear nerve, abducens nerve, CN6. Explanation. The oculomotor nerve controls most eye movements, eyelid elevation, and pupillary constriction. Compression by an aneurysm of the posterior communicating artery causes down-and-out gaze due to unopposed CN4 and 6, ptosis, and a dilated pupil, mydriasis. 8. A newborn presents with swelling of the scalp that does not cross the suture lines. What is the most likely diagnosis? A. Caput succedaneum, B. Cephalohematoma, C. Subgaleal hemorrhage, D. Epidural hematoma. Explanation. A cephalohematoma is a subperiosteal hemorrhage that is confined by suture lines, usually due to birth trauma. Caput succedaneum, by contrast, crosses suture lines and is more superficial. 9. A 55-year-old patient with diplopia cannot abduct the right eye. Which cranial nerve is likely affected? A. Optic nerve, CN2, B. Oculomotor nerve, C. Trochlear nerve, CN4, D. Abducens nerve, CN6. Explanation. The abducens nerve, CN6, controls the lateral rectus muscle, which abducts the eye, moves it laterally. CNV-side palsy causes inability to move the eye outward, resulting in horizontal diplopia, double vision. 10. Which structure is most commonly compressed in trigeminal neuralgia, causing severe facial pain? A. Internal carotid artery. B. Superior cerebellar artery. C. Middle meningeal artery. D. Anterior communicating artery. Explanation: trigeminal neuralgia, severe stabbing facial pain, is most often caused by compression of the trigeminal nerve, CNV, by the superior cerebellar artery, leading to episodes of intense pain triggered by touch, chewing, or temperature changes. These questions cover